Hi everybody, welcome to this webinar. My name's Russell Cartwright. I'm Assistant Director of Communications in the NHS in South East London, and I've worked in NHS communications for over 23 years now. I'm also a behaviour change specialist, and I've learned a lot about using behavioural science to have a kind of real impact on public health. I've leading kind of several campaigns that have won global and national awards in the last 5 years or so. I'm now also, because in that time I've kind of developed my passion for this work, and I'm now also working as a consultant to train and support other in-house teams to incorporate behavioural science into their ways of working. And as part of that, I set up this public health communications hub with the support of friends at Can Digital as a place for us as professionals to come together to solve problems, to share learning, and also good practice. And part of that is running webinars like this. This is the fifth one of these that we've done, and recordings from all of the previous ones are on the hub, so you can access those. We are recording today, so by being here with your camera on or off, you are kind of consenting to be part of that recording. Yeah, and we will share the recording from today with you all early next week. A couple of things just to say really before we properly get going. If the hub is very much designed to be for you and useful for you, and we want to cover topics and things that you will find helpful in your job. So if you've got any suggestions for things that we should cover in future webinars or areas you'd like us to focus on, please do pop it in the chat. Also, as we go today, please do put any questions to us in the chat, and we'll try and cover them if we can, or if not, we'll cover them afterwards. So I'm joined today by John Paul. JP, would you like to introduce yourself?
Yes, hello everybody. I'm John Paul from Can. Can is an organisation that runs campaigns for the public sector, and we specialise in creating measurable, low-cost per outcome campaigns. And very happy to be here.
Thanks, JP. So this is what we plan to cover today. I think we're looking at the kind of priorities and also the challenges that we face in the sector as we go into the new financial year. There's a lot of challenge, as I'm sure we're all aware. Obviously, finances are very challenging in both the NHS and local authorities, and these the financial challenges are only likely to get worse. There's significant backlogs in the NHS in terms and in social care in terms of care. There's demand continues to increase. There are crises of staffing. Some of the strikes are still not yet resolved. In the NHS, we're moving into new smaller teams in ICBs, and sadly losing some colleagues. There's a great need to focus on prevention, which is often hampered by our kind of constant needs to firefight and react. And on top of all that, we've got a general election coming and a possible change of government with lots of new policies to come, I'm sure. So we'd like you now to take a quick poll, which JP is going to start, to identify which of these areas you think will be priorities for you. So JP, if you could start that poll, please.
Done.
Brilliant, thank you. And we'll come back to those results shortly. Oh, my slides keep jumping forward and back, but okay. So at a previous webinar, we discussed winter communications, and I've been running a survey and doing as part of some research that I've been doing, and I think I'm not going to dwell on this for too long because obviously we covered it in a previous webinar, but I thought it'd be helpful to feed back some of those results. And also winter is particularly relevant as we talk about planning for a new financial year. So thanks to everyone who took part. We had roughly a 50-50, well, no, we had exactly a 50-50 split actually between people who did the survey from the NHS and people from local authorities, which is really good. There is a prize winner, and we will be informing the lucky prize winner imminently. I've produced a 3-page report into the research, which I'm hoping will be helpful or useful for you, and it might help.
Yeah. So wait. What come to you, bro? Colombia. Colombia.
Sorted.
Yeah, so sorry, I've produced a 3-page report which can hopefully be useful, helpful for you, and help you where it's needed to try and change the behaviours of your senior leaders. And we will share this report with you next week when we share the recording. But before that, I wanted to share some of the kind of key findings with you now. So out of the people who did the survey, just 40% actually had a budget for winter communications in 23-24. And out of them, a third of them had the budget confirmed before the end of June. And unsurprisingly, 70% of all the people who took the survey would like the budget confirmed before then, because that, as we know, allows us to plan effectively and to maximise our impact. There was some good news in the survey, so shows I think this is real progress in terms of joining up our communications across partners. So that nobody said that there was no joining up of messages, which is really good. 50% said some sharing of winter messages across partners. 30% said messages were coordinated across the local authority and the ICB, and 20% said messages and activities were shared by all health and care partners in the system, which is really good as well. Some other kind of things that aren't necessarily covered on this slide, and some of these might not be a great surprise to you, but national messaging often arrives too late for us. We don't get it in time to have impact. It's difficult to have an impact with no budget, or when the budget is received very late. Some of us can be a bit reluctant, and I've done this myself, when we get a budget very late, especially if we don't get a budget for campaigns very often. We're a little bit reluctant to say that what we didn't work as hoped. But I think we all need to be better at doing that, and better at evaluating and sharing openly with our leaders the outcomes. That way, when our resources are limited, we can kind of focus on what we know is likely to work. Just on the right of the screen, you can see a case study that I've included with a little bit more detail in the report. But I think this is a really, really good campaign, which has won a couple of awards. So it's Shropshire, Telford, and Wrecking ICS. And I think it's a great example of what can be achieved when resources are identified early. Their system is an incredibly challenged one, kind of financially, pressure-wise, demand, all real pressures that are real to lots of us. But by being creative, by being brave, their team, led by Edna Bwampong, have used behavioural science to achieve some really incredible results with a relatively modest budget, and that relatively modest investment has brought a great return. And you can see those results on the right hand side. The 7% reduction in A&E, increase in minor injury activity, increase in online activity, decrease in lost ambulance hours, which makes a massive cost saving. I think it's easy to come to the assumption that because our organisations are financially challenged, we can't get any money for comms. But actually, using the data and using the evidence, and building your case by demonstrating things like this, in a way, it could be an opportunity because that is a massive saving to the system there with a relatively modest investment. So yeah, I wanted to share that campaign. I'd quite like to get Edna actually to come to one of these webinars and go into a bit more detail about that campaign and about what they did, because it is a really good example. Yeah, so that's the winter comms, and like I say, you'll get the 3-page summary of that next week. So moving on, we promised to give you a few examples of some tried and tested campaigns that could kind of help set you up for next year, and smoking cessation is one of those. So we've done a webinar on this specifically, and again, the video of that is available. But just very quickly, some things that could be of use to you. So there's the Amazing Things Happen campaign, of which can easily be adapted and localized and reused in your area if interested. Had some very good results in London, 9 million plus views, almost 40,000 clicks. But the most important thing for me is that UCL did some research and they attributed approximately 3,000 extra quit attempts to the campaign. So that is something that, like I say, that could potentially be easily adapted for your use if there was an interest for that. Other ones that we featured. So Greater Manchester, their What Will You Miss campaign uses great kind of powerful, hard-hitting messaging for high dependency smokers, and then different messaging aimed at lower dependency smokers, kind of game-framed messaging. And again, they found that out by doing lots of research and really getting to know their audience and developing their insight, which is key for any behaviour change campaign. I've also included on the slides, and I'll put the links in chat shortly, a couple of resources that Ruth Dale from the behaviour change marketing has put together. So there's a guide for communicators to producing smoke-free campaigns. She's also done a blog and a really good podcast with 8 top tips, which were done for No Smoking Day, which I know has just gone. But and if anyone's looking to do comms around smoking, it's well worth a listen. It's not very long, but some really good tips in there. So I'm going to move on to JP shortly, but I'm going to talk about measles and MMR, which is obviously very topical and is a priority for a lot of us. Just to set the context a little bit, we know that vaccination rates are down. We've also, as well as amongst children, we've got a generation in their 20s whose parents were influenced by the Andrew Wakefield controversy. So there are a fair number of unvaccinated young adults as well out there. And sadly, we are starting to see outbreaks of measles, which is a concern. We also know that there is significant inequalities when it comes to vaccination rates. But just looking at now, this research is a little bit out of date. It's pre-pandemic. But the RSPH did some research in 2019, which showed that 91% of parents agreed that vaccination is important for their child's health. It then delved a little bit deeper and looked at some of the barriers. What stops people, if that's the case, well, what does stop people getting vaccinated? And a lot of it was, kind of convenience things. So timing of appointments, availability of appointments, childcare, and that sort of thing. So for them, it's trying to kind of move them from intent to action, and that's what you need to focus on. But then we also know that that research also found that 10% chose not to give their child the MMR vaccine. And for 70% of them, it was due to fear of side effects. And 34% thought the diseases that it protected you from aren't serious. So there is some work to do around kind of informing and trying to change those behaviours as well. I'm going to hand over to JP, who's got an example of tried and tested creatives for this topic.
Thank you, Russell. Yeah, so we've looked across a number of campaigns, specifically around MMR, that we've run, trying to find examples of the top performing creatives across the country. And I just wanted to share some of that data with you. Now, these aren't all the same at all, but it's interesting to see maybe some common themes in the creatives that work well. So multiple campaigns, lots of data around different ads, and a number of campaigns running at similar times across the country. In Surrey, they use this sort of child superhero motif, which we've seen in other places. And this one happened to be a red theme, was the one that got interacted with the most. And funny enough, it's interacted with by men much better than females. Usually men are about half as likely to interact with an ad as females, but this ad bucked that trend. So the idea of protection and giving your children superpowers seems to have worked well there. In other parts of the country, using some of the centralised assets and then tailoring them to local communities. This was one, and again, men interacted with this a lot more than average in average campaigns. Using animation certainly helps, and certainly helps in terms of pushing views. This was bolstering Russell's point about making vaccination easy, convenient, and so on. In Redbridge, the highest interacted with messages tend to be around walk-ins. So you tend to run an awareness campaign and then have highly geo-targeted ads placed 1 mile radius around that walk-in for a few days before, or for however long the clinic's running. So we always see these working very well. But the best performing ad was this one, which was a central government created, animated, and it's now stopped animating, but we will share this afterwards. But that was by far the most interacted with ad. It generated about 7% interaction rate, which is something which is very rare. So an example of central government creatives when they're made with high production values, working really well at the local level. So Russell.
Yeah, did you want to go into physical activity?
Yeah, okay. So I'll take you now on to apologies, the other campaigns that we've been running.
While JP is doing that, just to set the scene, I suppose. Physical. Most of us, I mentioned earlier about the need to move on from firefighting and to focus on prevention, and physical activity is a massive area for us all. There is that whole thing about 20% of health and well-being, it can be influenced by services, but actually the rest can be influenced by lifestyle itself. And physical activity is a massive part in that. And there's some great research about if people were more active for half an hour a day, what it would do to reduce so many of the most common diseases, so many of the things actually that we've just been kind of selecting as our priorities. And physical activity is a massive thing that we can't solve within one organisation. As it's something that we need to collaborate with our partners on, and I'm sure it's a massive issue everywhere. So and again, I think you've got another example of something that's worked well.
That's right. So in Richmond, which is admittedly a more affluent area, but a campaign was run called Richmond Moves, where they were promoting yoga, walking, and cycling. And you could see there, in terms of interaction rates, it was very much the cycling creative which worked particularly well. I'm just going to move here. You could see that there were strong interaction rates everywhere. However, if I can just get this to move along one. Hold on, I'm so sorry about this. I'm going to stop sharing, go here. So this was the general creative that was used, encouraging people to interact and choose an array of activities that were possible in Richmond. But then this is the creative that got the most interaction. Now, it was use of imagery from Richmond Park, so probably something that's recognisable and an image that people could associate with at a local area. And that's why we saw those excellent interaction rates with it. We also then cross-pollinated between two campaigns. There was a separate campaign in Richmond from their leisure centres, and we used the audience that had shown interest in the Richmond Moves campaign, and then started to put a whole array of different opportunities for those audiences to interact with, swimming, fitness courses, hiring of pitches, hiring of courts, even booking of children's parties. And that ran afterwards. Now, the one thing about that was they went from being at, I think, sort of 50–60% occupancy to nearer 80 or 90% occupancy, which was very good for Richmond in terms of having full usage of those and then the income that would come out of that. But it also meant that the leisure centres could share an outcome with public health. It was sort of a win-win for both. So we were able to take some of the outcomes for this and attribute it to the activity that had been done before. So in terms of cost per outcome, absolutely fantastic. And in terms of delivering a measurable outcome, that was also very, very powerful. Thinking about, moving more, it might be that we're thinking about moving people away or out of their cars, particularly when you're in more rural locations. And that's where promoting bus travel is another sort of campaign which gets people out of cars, gets them moving a little bit more. And that could involve partnering with the local transport organisation. Sometimes it's in-house, sometimes it's owned by a combined authority. But again, a bit like with the leisure centres and with the Move More campaign, partnering with other organisations in the local area can lead to outcomes which, when you take the ticket rates increases from certain populations, could be attributed in a partnership campaign to public health. And there are messages around it being easy, convenient and low cost to get the bus. Those can also then cross-pollinate with shop local campaigns and many others. So just some examples there around approaches to increasing physical activity from across the country. Now I'll hand back to you.
Thanks, John Paul. So actually, I'm just going to have a quick look at the results from the first poll, and it's interesting to see. So mental health is the highest scoring out of all of those options, and that was the topic of our last webinar. Actually, we had a really good discussion with Sue, one of the the founder of the Time to Change campaign, which again the video of that is available, but I'd be really interested to hear, that's clearly a big priority. Mental health is clearly a big priority. So if there are kind of other areas that you'd like us to cover, or that you think we could try and work together on, or, solve problems together, then please do let us know, either in chat or, by all means, email me afterwards, and we can try and line up. And also, if you know of good work that we could highlight that others can learn from as well, do let us know, please. So then we've also got the physical activity is there. I think one of the highest. Vaccination, that's no surprise. Health checks is quite interesting, actually. That's come up quite high, and that's not something that I've particularly focused a lot on. It's certainly not something that I've seen us putting much resource to. It's something that is often talked about, but in the last few years, other things have often superseded that. Smoking cessation is obviously there. That's good to see, and and demand management again. That's clearly an issue, and it has been an issue for as long as I've worked in the NHS, but it's a bigger issue now than it's ever been. Okay. So We'd like to ask you a couple of other questions, actually. So, and John Paul, if you can start the next poll, which is about what concerns you most about fulfilling your role in the next financial year. What's kind of top of, or the top few things of your worry list? Lack of resources, yeah, that's clearly one. So yeah, if I can get the rest of you to just put some quick things in there. Can we start more than one poll at a time, John Paul? Is that
Yes?
Yeah. Okay. So if you could start the other one as well, please.
Yes.
So we're also going to ask is the next one has a number of responses, but it's about what could help you next year. Which things out of the list on the question could be really helpful for you. So again, if I can ask you to fill that in, you can select more than one of these. Yeah. Shall we give people a minute to do that, John Paul? Or should we? Yeah. Should we move on and talk about the next thing, or should we just wait and?
I'll just give it 30 seconds. And then
yeah. Yeah.
Thank you so much for submitting, because this helps us shape how we plan future content together. One thing that stood out for me last week was listening to an ad industry expert talking about the bias of communications professionals towards the big expensive things. And when something's, radio, TV, something like that, we'll spend a disproportionate amount of time on it just because it's expensive. However, one of the things that doesn't cost much, and then unfortunately doesn't get enough attention, is around partnerships. So drawing on what we saw around physical activity, with the potential partnerships with Shop Local, transport, climate, public health, all around pushing increased physical activity. Start to look at, well, is that just limited to those fields, or are there more opportunities for collaboration? I have the opinion that as time and resources are shrinking considerably in ICBs and certainly in public health and councils, this could be one of those relatively light touch, incredibly powerful strategies that we need to think about more and work. So we've been spending time this year looking into it, trying to understand where the potentials are and what the barriers are to working together. And so this is what we've put together to help you address that. So we often hear about audiences that are the targets for campaigns. Very frequently low-income households, very frequently parents, less frequently, unfortunately, young people. But there are all these campaigns targeted at these audiences almost throughout the year. And we're trying to sort of start to think slightly more holistically about...
checked in.
Can everyone hear okay? About these campaigns that are coming up. Now, we know they're probably going to come up in the year, but how would one go about creating the connections between these campaigns? For example, looking at when MMR, polio or flu campaigns are running, which we know there are press for that now, but maybe connecting those with childcare support, family activities, even parks and green spaces, or taking campaigns maybe that are targeting increased physical activity and connecting them with sports facilities and parks and green spaces like we've seen happening in Richmond. What about also looking at mental health and helping young people who might be isolated use the bus to get them into work, to school, and to potentially more social occasions to improve that. When we're looking, for example, at health checks, often those are targeted at audiences from lower income households. So why not cross-pollinate cost of living with health checks? Also, we've seen cost of living campaigns doing a great job when partnered with adult mental health campaigns. So as you start to build, you can actually say, well, adult mental health could potentially work just with parks and green spaces, about walking every day and being out in nature, which is known to improve mental health. But then taking adult mental health and giving people choice architecture around, maybe swimming's good for you, or walking the park, or maybe there are leisure opportunities and events coming up that would help on that front. So that once you start looking into it, the opportunities become quite interesting. But how do you navigate this as either working in public health communications in a council, working then with other people? So we've come up with this new sort of collaboration event where we get and we ran one in January in Nottinghamshire, where we had the ICB, communicators from public health, but also local colleges, fire, ambulance, police, basically people from across the public sector in a room together, talking about one specific subject. In this instance, it was around engaging young people, because Nottingham was becoming a child-friendly city, and then looking at the various opportunities to collaborate, and then almost matching and sort of dating different campaigns together, and then at the end of the day coming up with plans to do that. And one of the things that we created here was a map which we've been filling in, and we'll probably fill in a lot more once budgets are agreed in April, but just so that everybody in that location could see who was doing what and when, to then look for potential campaign cross-pollination opportunities. So it does require a bit of a commitment, but getting together in person and focusing on a subject that's really pertinent, I think a lot around social mobility and in addressing inequalities in certain parts of the country at that kind of ICB level, with council partners and an array of public sector partners together, could be really powerful and really exciting. And so we're speaking to groups in North and South London, also in West Yorkshire and Cumbria, and a couple of other locations, and putting these into place for kind of May and June time. Now, CAN are happy to fund these, fund the location, fund lunch, but we need people who are interested in this to let us know if they'd like to have one in their location, and then really kind of lead it with your public sector connections to help co-create the event that's pertinent to everyone in there, and will hopefully give people a bit of inspiration, a bit of free training and learning, but critically as well, end up with a set of plans that can then be implemented. Hopefully plenty of time, from June, July, to implement things around winter demand, around vaccination, around all these things that weigh on us. And a little tactic that Russell's going to be deploying into these events is to get senior management to attend the day at the end, to see the plans and to give their tacit approval and buy-in, so that when you go back to your desk, it becomes a topic of conversation moving forward. What are the advantages of this approach? Well, there's certainly shared outcomes. There's the need, it creates the need for longer term planning and senior buy-in at an earlier stage. It might also make those plans a little bit stickier because they're working between different partners, so less harder to deprioritize with other reactive requirements. It also means you get the advantages of co-creation, also the use of other public sector assets, the councils being particularly powerful in being able to use their web and digital estates and out of home to support campaigns for very, very low costs. You also then get the ability to have measurable outcomes data coming from services, coming from parks, leisure centres, buses, even footfall management and traffic management into public health campaigns. So we believe there's a lot there, and the wonderful thing about it is it doesn't require more money. It requires the dedication of some time, some extra communication with local partners, and then we can make the rest of it happen. So if that sounds like something you'd like to do in your area in May or June kind of time, please drop me and Russell a line, and we'd love to put more of these events in your calendar in the local area. That's it from me on that one, Russell.
Just to add to that, I mean, I'm a really strong believer in kind of working together, and I think, you know, the challenges we all face, it's the only way we can actually, you know, we can actually make the most and maximize their impact. But actually, you know, it's there's collaborating, and then there's, which, you know, or there's sharing each other's stuff, or actually sitting down around a table and problem solving and mapping out, you know, right, this is a shared priority. Why are we doing our own work on this? Let's work on it together. Let's, you know, let's solve that problem. Let's pool our resources. Let's, you know, plan together. Let's use all of our channels. You know, let's I think, you know, that is the way forward, to, you know, across the NHS and local authorities. That's the way that I think we as a profession can really deliver value. So it'd be really good to try and, you know, help you on your way to doing that and bringing, you know, all of those partners together. Or you're on mute, John Paul.
Of course, when we get to meet in person and have a nice lunch together and things like that. But I think as well, one thing that we didn't anticipate at the end was the sense of hope and positivity that people in the room had, which I think is much needed at the moment across the public sector, certainly communications community and beyond, and giving people that lift just as we start to, you know, trying to do even more with even less, I think is really important.
Yeah. Great. I'm just checking if there are any questions in the in chat. I don't think I saw any actually. So I think
there's Maria Jones talking about in Shropshire, combining mental health and well-being with the cost of living work pages is brilliant. Shropshire and Telford Record are doing a lot of good stuff, aren't they? Yes. It makes so much sense, and it makes it really works for people, because the drivers and triggers for many of these problems are interconnected, and I think that's where communicators can add so much value in terms of just making those connections to achieve multiple positive outcomes.
Yeah.
Hi, Maria.
Hiya. I'm sorry, I'm not feeling 100% today, so that's why I haven't got very much to go. Just to add to that, the team are pulling together a toolkit that will go out to frontline staff. It's kind of like a making every contact count, but in terms of things that they could be eligible for in terms of money and stuff. So it will go out to lots of different people who obviously work with vulnerable people. So it will signpost them to a lot of different services, as well as checking that they are, you know, up to date with their eligible, you know, benefits and other things like that, and services that they could access as well. So it's kind of like a one-stop shop of things. So the team have just been pulling that together at the moment, and they'll hopefully get a finalised one. So happy to share that once that's done, if you wanted to see that.
We definitely do. We'd love to see it and put it on the hub for everyone to get access to.
Done a really good job on it, actually. It's really good.
Fabulous. Thank you, Maria. Could I also, next week, it's a slightly different field. It's not so much public health focused, but it's around consultation, engagement and co-creation. And there is another brilliant example there of that on the ground community connection activity that's happening in Lambeth, and we'll have Graham sharing how they did that in Lambeth, and it's had staggering benefits for health and well-being, mental health conditions cleared, smoking cessation, so many benefits. They didn't actually intend for it to be quite as brilliant. They're very happy that it did, but there were so many unintended consequences, positive consequences, including one person is now an elected member of the council. Many wonderful things have started as a result of it. So next Wednesday, if you'd like to attend that, just drop me a line and I'll add you in.
Right, I think we should probably wrap up for today then. So thank you very much for coming. I wish you all a happy weekend when it comes, and do please get in touch. Like I said, if there's anything you want us to cover in future topics. The next one of these webinars is going to be on Wednesday the 27th of March, so you should get an invite to that soon. Thank you very much, and all the best.